Let me ask you something, and I want you to be honest with yourself. Are you already using peptides like BPC 157, sermorelin, or ipamorelin, and your doctor has no idea? If you said yes, you're not alone. There are thousands of people right now, Gen X and millennials especially, who've done this research, read the studies, and started using these compounds on their own. Smart, health-conscious people who just couldn't find a doctor willing to have an actual conversation about it. And I get it. You're worried they'll shut you down, make you feel judged, or just say, those aren't FDA approved, and end the appointment right there. But here's what I need you to understand. Hiding that information isn't protecting you. It's putting you at risk in ways most people never think about. And over the next 10 minutes, you'll know exactly why and exactly what to do instead. I'm Dr. Zaid Fadul. Today, I'm walking you through how to have that conversation with your doctor, what to bring, what to say, and what good medical oversight actually looks like. No judgment, just real information. If you're new to peptides and want a primer on what peptides are, the video is linked above. It covers how they work and why so many people in the longevity and biohacking space are paying attention to them. Stay with me. What you learn in the next few minutes could genuinely matter for your health. Okay, let's dive in. So why do people hide peptide use from their doctors in the first place? It almost always comes down to one of three things. They expect to be judged, they assume their doctor doesn't know enough about peptides to be helpful, or they feel fine so they tell themselves there's nothing to report. Here's a problem with all three of those reasons. The most serious side effects from peptides don't show up as symptoms you can feel. They show up silently in your lab work. Take growth hormone secretagogues like sermorelin, CJC 1295, or ipamorelin. These compounds raise your IGF-1 levels, which is the whole point. More growth hormone activity for muscle recovery and body composition. But when IGF-1 climbs too high and stays elevated over time, you can start developing the same complications seen in a condition called acromegaly. Insulin resistance, cardiovascular problems, joint pain, soft tissue swelling, and the dangerous part, these changes are slow and subtle. Published research in the New England Journal of Medicine confirms that even physicians frequently miss early acromegaly because the signs develop gradually over months and years. Then there's contamination, and this one genuinely surprises people. Independent lab analysis of unregulated peptide products found purity levels as low as 5%. Some products contain toxic heavy metals, including arsenic and lead, at concentrations up to 10 times the safe limit for injectable drugs. When you inject something, it bypasses every digestive filter in your body and goes straight into your bloodstream. To get a better understanding of these risks that most people in the peptide space never talk about, I covered all this in my Dark Side of Peptides video. Your doctor cannot protect you from risks they don't know exist. That's the bottom line. Coming up next, the exact checklist to bring to your appointment so that you walk in prepared, not caught off guard. The single best thing you can do before that conversation is come prepared. When you show up with organized information, you shift the dynamic completely. You're not a patient hiding something, you're someone taking ownership of their health. I personally love it when patients come in with a clear list of questions. That changes everything. Here's your list. The name of every peptide you're using, the dose, how you're taking it, injection, oral, nasal, how often, and if you're cycling, your on and off schedule, where you got it. This matters more than most people realize. Whether you're sourcing from a licensed compounding pharmacy or a gray market research site is clinically relevant. It tells your doctor how closely to monitor you and whether heavy metal screening should be on the table. Any symptoms you've noticed, even if you think they're unrelated, unusual fatigue, joint swelling, changes in blood sugar, skin reactions, anything unusual at the injection site, all of it matters. Your full medication and supplement list. Peptides can interact with other compounds, and your doctor needs a complete picture to interpret your labs correctly. At Bespoke Concierge MD, this is exactly the kind of conversation we have at every intake. Patients tell us everything, or they're supposed to. What they're using, where they got it, what they've noticed, and we build their monitoring plan around that. No lecture, no dismissal, just real clinical oversight. Walk in with that list, and you've already done more than most people ever do. You're giving your doctor what they actually need to help you. Now that you know what to bring, here's what your doctor should actually be doing with that information, including the exact labs that matter for each type of peptides. This is the part of the conversation most patients never get to, because most doctors either don't know what to order or they close the door before it even opens. Here's what responsible medical oversight looks like, based on the best available clinical evidence. Before you start any peptide, or right now if you're already using one, a baseline panel is non-negotiable. This means a comprehensive metabolic panel to assess your liver and kidneys, a complete blood count, and class-specific labs based on what you're actually taking. If you're on growth hormone secretagogues, sermorelin, CJC 1295, or ipamorelin, the core markers are IGF-1 and IGF-BP3. These are the most sensitive indicators of excessive growth hormone activity. You also need fasting glucose and hemoglobin A1C to catch early insulin resistance. A clinical trial of a growth hormone secretagogue showed statistically significant increases in both, even at relatively low doses. Add a lipid panel and thyroid labs. If you have any cardiac symptoms, troponin and an EKG belong on that list. If you're using tissue repair peptides, BPC 157, TB 500, or GHKCU, the focus shifts to liver and kidney health. ALT, AST, ALP, bilirubin, creatinine, BUN, and cystatin C. Albumin checks your liver's ability to synthesize protein. A CBC and CRP round it out. The preclinical data on BPC 157 consistently shows a strong safety margin. No serious organ toxicity, even at high doses in animal models. But that does not mean skipping monitoring. If you're using immune modulators, thymosin alpha-1 or PT141, the panel is broader. Thyroid function, cortisol, ACTH, CBC with differential, and inflammatory markers including CRP, ferritin, and LDH. These peptides can trigger immune reactions similar to what we see with certain cancer immunotherapy drugs, so we monitor multiple systems simultaneously. On timing, during an active cycle, especially when starting something new, labs every 2 to 4 weeks is the standard. On a stable, long-term regimen with no abnormalities, every 2 to 3 months is appropriate. Before every new cycle, your labs should be reviewed. If values have declined, you reduce your dose, extend your break, or pause entirely. Know your red flags: injection site reactions that worsen rapidly, new liver or kidney changes, shortness of breath, swelling, new onset high blood sugar, or any allergic reaction. Compartment syndrome from peptide injection has been documented in the medical literature. These are not situations to wait on. At Bespoke, we run all these panels. We track your numbers over time, flag changes early, and adjust your protocol before small problems become big ones. That's the level of oversight this requires, and it's what we're built to provide. We offer routine and comprehensive lab monitoring programs tailored to your peptide regimen. It's important to monitor your progress to set yourself up for success. Now, here's what this conversation should actually look like and sound like when you find the right doctor. If your doctor responds to your disclosure by refusing to run labs, dismissing your concerns, or making you feel like you've done something wrong, that is not good medicine. That's a physician who isn't equipped to meet you where you are. A good conversation sounds like this. I'm glad you told me. Let's get a baseline so we know where you're starting from. Based on what you're using, here's what I want to check and why. I'm not here to tell you what to do. I'm here to make sure we catch anything early if something comes up. This is harm reduction medicine. The same principle we apply across many areas of healthcare, particularly addiction medicine. One more thing worth knowing. Physicians are encouraged to report unexpected adverse events from any substance, including non-FDA approved peptides, to the FDA's MedWatch program. This isn't about getting anyone in trouble. It's how the medical system builds its safety record, and it's part of responsible care for everyone who comes after you. Let me bring this home. If you're using peptides right now, tell your doctor. Bring your full list, get a proper baseline before your next cycle. Make sure the right labs are being monitored on the right schedule and know the warning signs that need immediate attention. If your current doctor won't have this conversation, that's not a you problem, that's a care gap. At Bespoke Concierge MD, this is what we're built for. We're a virtual primary care practice designed for people who take their health seriously and expect their doctor to keep up. We have the real conversation that most practices don't make time for. Whether you're using peptides for healing, performance, or longevity, you deserve medical oversight that keeps pace with how you're actually living. And if this video gave you clarity, please share it with someone who's using peptides and might not have good medical support. And drop a comment naming a peptide you'd like me to review. I'll break down the science and validated benefits of the ones most frequently mentioned. For those of you exploring peptides and how to incorporate them, the video on the right reviews what peptides are, how they work, and the impact they have made on medicine. The playlist on the left covers peptides and related issues in full detail. And hit subscribe. I publish evidence-based medical content every week that could change your life. See you in the next video.